Why does snoring cause heart failure? Now, this is an incredibly high yield medicine concept for the USMLE, so let me make it simple. I will start by asking you this first. What is snoring physiologically? It's the partial obstruction of the upper airway. And if that obstruction becomes complete, the patient stops breathing. That is called as obstructive sleep apnea, and this is where the cardiac damage begins. Now, when someone stops breathing for 30 to 40 seconds at a time, what happens to their oxygen level? It drops. They become hypoxic, and I'll ask you, what does hypoxia do to the pulmonary vasculature? This is the key, because hypoxia causes pulmonary vasoconstriction. It's actually a protective mechanism called hypoxic pulmonary vasoconstriction, where the lungs try to shunt blood away from poorly ventilated areas. But in sleep apnea, the entire lung is hypoxic, so you get diffuse vasoconstriction rather than localized vasoconstriction. If this happens hundreds of times per night, every night for years, you get chronic pulmonary hypertension. And what happens to the right ventricle when it pumps against an elevated pulmonary pressure year after year? It hypertrophies, then dilates, then fails. That's called cor pulmonale, right heart failure from lung disease. But it doesn't just stop there. When someone tries to breathe against a closed airway, they generate massive negative intrathoracic pressure that increases left ventricular afterload, plus the sympathetic surges from hypoxia causes systemic hypertension and arrhythmias. So you get left heart failure too, along with right heart failure. So for the USMLE, when they give you an obese patient with daytime sleepiness, morning headaches, loud snoring, witnessed apneas, and now this patient has resistant hypertension or unexplained heart failure, many students will jump straight to ischemic cardiomyopathy, but the answer is obstructive sleep apnea. So you need to do polysomnography, which is the gold standard to diagnose this first, and then put the patient on CPAP to treat it, which can actually reverse the cardiac dysfunction.